Well, Pfizer's CEO now recommending that a fourth COVID shot is necessary due to waning immunity. He also said that the drug maker is working on another shot that could possibly handle all COVID-19 variants. Right now, anyone aged 12 and up who received 2 shots of the Pfizer vaccine are eligible for a third booster shot. So when will all of this madness end? Let's bring in our panel once again to talk about that, both Ford and Melanie. I know that you both came down with COVID yourself, both tested positive. Ford, you were in the hospital. Your thoughts on hearing that yet another booster shot is being recommended?
Well, look, I'm not anti-vaccine, but I have to be honest, COVID has been a boondoggle for Pfizer, so it's very hard for me to take them seriously on a fourth booster shot. In 2021, they had 92% operational growth, and I believe in 2022, Pfizer's expecting $54 billion in COVID sales. I'm starting to wonder exactly who it is Pfizer's concerned about protecting, the people or their actual bottom line. And look, COVID is a very serious disease, but people need to do what's best for them.
Yeah, and Melanie, this coming on the heels of President Obama announcing just yesterday that he tested positive for COVID-19, but took the opportunity to once again reiterate the importance of these vaccines and booster shots.
You know, I can't really repeat what I said when I saw that headline because it's not made for television. But that I thought to myself, I bet you do think that I should have a fourth shot. Like, since when do we listen to the person who literally stands to make the most money from the shot? The people who make the most money from selling things like this are the CEOs and the shareholders. And not for nothing, forgive me if I don't take advice from the CEO of Pfizer on how many shots I should get. I recommend that you listen to Money Talk with Melanie 5 times a day. I have no vested interest in saying that you should listen to, I mean, come on. It's that ridiculous. You're seriously conflicted out of advising anyone on how many shots we should get. We will listen to our doctors, look at the data if the CDC ever chooses to release it, and make our own decisions. But I give that a huge no thank you.
And I know, Melanie, you take it just as seriously as Ford does. But Ford, I'd say this is also another indication, both the questions that you're both raising, a problem that developed from the very beginning with people not necessarily knowing if we were following the science or if we were following, people's money pockets, or we were following the political science in all this.
Well, that's exactly right, Heather. Notice Dr. Fauci hasn't been on TV in the last 3 to 4 weeks. I think there might be a reason why. COVID destroyed trust in big pharma and in government institutions like the CDC and the NIAID. And unfortunately, it's going to take years to repair that trust. Let's not repeat the same mistakes again, because what's happening here is politics and greed and not physical science and human science when it comes to protecting people's immunity.
Yeah, and I think Senator Rand Paul is suggesting some legislation to do away with Anthony Fauci's role altogether. All right, Ford O'Connell, Melanie Collette, thank you both very much for joining us today. Another day of a lot of breaking news, so we had to cut it a little bit short, but thank you.